Okay, students, although this fetal and neonatal physiology, this is not particularly a part of the reproductive physiology, but you should know that how the newcomer, the newborn, it survive his or her entry into our world, for which he has to make certain adjustments uh, so that his or her breathing it could assume the normal respiration, and then there are circulatory adjustments at birth, and finally we will see that how the nutrition that is provided to the neonate. So, starting with the changes in the respiratory system, but first you should know that how the fetus physiology is different from our physiology. You should know that the fetal circulation that is different from that of the adults because of the presence of placenta. Since the fetal lungs they are non-functioning, so placenta is responsible for the exchange of gases between fetal blood and mother's blood. So the blood from the right ventricle that is diverted to placenta, and from placenta the umbilical veins they collect the blood. Now this blood it has more oxygen and nutrients. Now, the umbilical vein it passes through the liver, so some amount of the blood that is supplied to the liver from the umbilical vein, however, large quantity of the blood that basically is diverted from the umbilical vein into the inferior vena cava through a ductus venosus, and liver receives blood from portal vein also. Now, what happens that in liver the oxygenated blood it mixes slightly with the deoxygenated blood and it enters the right atrium via inferior vena cava, and from right atrium a major portion of the blood that is diverted into left atrium via foramen ovale. Keep in mind that foramen ovale, this is an opening in intraatrial septum in the fetus, which you might have studied in embryology. Now, if we focus on the fetal lungs, you should know that the pulmonary vascular resistance, that is the resistance which is offered to the blood flow through the pulmonary vascular bed. Now, this resistance it is very high in the fetus because of the non-functioning of fetal lungs. This high resistance in the fetal lungs it increases the pressure in the blood vessels of the lungs, and because of the high pressure the blood is diverted from the pulmonary artery into aorta via a ductus arteriosus, and these structures they you might have heard them for the first time because they are present only in the fetus. Normally, these are not present. The ductus arteriosus, ductus venosus, and then there is foramen ovale. So, let's see that how the circulatory system and the respiratory system that changes at birth, and this is all interconnected. Uh, if we talk about the first breath of the child, you see, when fetus is delivered and the umbilical cord is cut and tied, the lungs they start functioning. When the placental blood flow is cut off, there is sudden hypoxia and hypercapnia, right? I'm repeating again that you see when the baby it has been separated from the placenta, and there is the placenta is no more a source of the exchange, there will be hypoxia and hypercapnia, And now the respiratory center of the newborn that is strongly stimulated by these two factors, and the respiration starts. Initially, although there is a gasping, which is followed by normal respiration. So, you see, the lungs they expand during the first breath of the infant, and the expansion of the lungs it causes immediate reduction in the pulmonary vascular resistance and a sudden fall in the pressure in the blood vessels of the lungs. So, what happens? Therefore, the blood flow from the pulmonary artery to the lungs that increases. Here, I don't want to skip the mention of a very important factor uh, which is applicable at the time of the birth. You see, you might have studied it in the respiratory physiology that the surfactant that is responsible for the stabilization of the alveoli, um, and you see, this surfactant it plays an important role in the inflation of the lungs after birth. In fetus, the secretion of the surfactant it begins after the third month. Until birth, the lungs they are solid and not expanded. But soon after birth, the first breath it starts because of the stimulation of the respiratory centers by, as I already told you, by the hypoxia and hypercapnia. Although the respiratory movements they are attempted by the infant, the lungs they tend to collapse repeatedly, and the presence of surfactant in the alveoli that prevents the lungs from collapsing, right? So what will happen if the surfactant become deficient in these newborns? You see, in infants the collapse of the lungs it occur due to the lack or the absence of the surfactant, and this condition is called respiratory distress syndrome. This is called infant respiratory distress syndrome, IRDS, or this is also called the hyaline membrane disease of the infant. That how the normal respiration that is achieved by the fetus, by the newborn, and now we will have a look at the changes which take place in the circulatory system to assume full function. These changes include the closure of foramen ovale and also of the ductus venosus and ductus arteriosus. And also there takes place a reversal of the blood flow in the ductus arteriosus. So when blood starts flowing through the pulmonary circulation, the oxygenated blood from the lungs that returns to left atrium, and it causes increase in the left atrial pressure, and simultaneously due to the stoppage of blood from the placenta, the pressure in the inferior vena cava that is decreased. It leads to fall in the right atrial pressure. The pressure in the right atrium is less, and the pressure in the left atrium that is already high. So this causes the closure of the foramen ovale, and within few days after birth, the foramen ovale that closes completely and fuses with the atrial wall. You should also know that in fetus, since the pulmonary arterial pressure that's very high, the blood passes from the pulmonary artery into the aorta via ductus arteriosus. But in neonatal life, since the systemic arterial pressure is more than the pulmonary arterial pressure, the blood passes in the opposite direction in ductus arteriosus, means it passes from the systemic aorta into the pulmonary aorta. Uh, the reversed flow in the ductus arteriosus that could be heard as a continuous murmur in the infants. Well, you can write down all these changes. The next one, that is the closure of ductus venosus. You see, due to the contraction of the smooth muscle near the junction between the umbilical vein and the ductus venosus, the constriction and the closure of the ductus venosus that occurs, and later the this ductus venosus that becomes a fibrous band. And the ductus arteriosus, it has also to be closed. This ductus arteriosus that starts closing due to narrowing, and it closes completely after 2 days, and the adult type of circulation that starts. Uh, if I give you a pathological condition, in some rare cases, the ductus arteriosus, it does not close and it remains intact, producing a continuous murmur. And the condition with intact ductus arteriosus, that is known as patent ductus arteriosus. Let's now move on to the nutrition aspect of the neonate, which is provided by the uh, female's breast. Although small amount of the milk excretion that occurs at the later months of the pregnancy, but a free flow of the milk that occurs only after the delivery of the child. And the milk which is secreted initially before parturition, that is called colostrum. Even that colostrum, that is very important. This colostrum is a lemon yellow in color, and it is rich in proteins, particularly the globulins, and then it is rich in salts, but its sugar content is low, and it contains almost all the components of the milk except the fat. Now you see the galactopoiesis, the formation of the milk, which is providing nutrition to the neonate, that occurs up to 7 to 9 months after the delivery of a child, uh, provided feeding the baby with the mother's milk that is continued till then. In fact, the milk production that is continued only if feeding the baby is continued, because the suckling of the nipple by the baby, that is responsible for the continuous milk production. Anyway, mm, so the point is that the breast milk or the human milk, that is the milk which is created by the human female, and it forms the primary source of the nutrition for the infants. This breast milk, it contains about 89% of water and 11% of solids. The important solids, they are lactose, lactalbumin, iron, vitamin A, and vitamin D, and also the minerals. And you see, this breast milk, that is always considered superior to the animal milks, such as the cow milk or the goat milk, because this breast milk, it consists of sufficient quantities of all the substances which are necessary for the infants, like iron, vitamins, and minerals.